Welcome to Gutsy Talks. I'm Rachel Larsson, your host, naturopath and nutritionist, and I'm here to have real, honest conversations that can help you heal your gut, calm your mind, and fall back in love with food. Together with leading health experts, we'll dive into all things gut health and explore the deep connections between your gut and overall well-being, so you can feel empowered to take control of your health and live your best life. If you love all things gut health, follow me for more on Instagram at rachel.larson or head to rachellarson.com.au. Now, let's get into today's episode. Welcome to today's episode. I am beyond excited to be sharing with you this topic. It is something that I am super passionate about. I have seen it over the last almost decade of my clinical practice change the lives of people who have been told that living with bloating, diarrhea, constipation, stomach aches, and food reactions are their normal. And no, we're not talking about IBS. We're talking about the thing which is most common misdiagnosed or just not diagnosed instead and is called IBS. And we're talking about SIBO. Now, if you haven't heard of this, this really is for you, and it is for you to share with anybody that you know that has these issues and symptoms that I've mentioned, and I will obviously show you a lot more, but it really is a game changer. Now, if you have heard of SIBO, you still need to listen to this. There is things that I'm sharing with you which will help you along your journey or get you really thinking about, is this something that you need to test for, just to rule it in or rule it out? So SIBO, what is it? And you may also hear it be pronounced as SIBO. SIBO, same thing. What it stands for is small intestinal bacterial overgrowth. So when I talk about SIBO, that's what I'm talking about. We really want to get a clear idea as to what this is so we can talk about the complexities as to how it's showing up, what it's doing in the body, how we start treating it and testing it. So when we're talking about SIBO, what we are looking at is that there are normal bacteria, not pathogens that we would assume are, the really nasty ones, things that we call pathobionts, but I guess just to make it easy, they're normal bacteria that are in the wrong place. So we should be having these normal bacteria to some degree in our large intestine. When they are in the wrong place and in the wrong amounts, that's where they become a problem. And the small intestine is a space in the digestive system that doesn't want that much bacteria. Now, the word pathobiont, which I just threw in there, these are naturally occurring bacteria. They're not things that necessarily warrant antibiotics, but when their communities get too big, there's too many of them, they're in the wrong place, that's where they become problematic. So they're not at the core bad things. It's just more about how they are working within the community and within the location. So when we have this abnormally large amount of bacteria in our small intestine, these bacteria ferment starches and fibers that create gas that cause damage to the small intestine, which, becomes symptoms. And so just to backtrack what that actually means, when we're talking about our digestion, a lot of our food, especially our fibers, get fermented. This is what our bacteria love to do. Our fiber is their food, and then as they eat that food, they create byproducts which are beneficial to us, and also gases, which is just part of the process. If you think about brewing beer or brewing kombucha, there's a gas and bubbly component to it, and the same goes in our gut. Now, our bacteria, when they're in the large intestine, they do this is totally fine. But when they're in the small intestine, they are also doing this. The problem is that our small intestine isn't set up for that type of behavior. We don't want that small intestine to be a fermentation place. Instead, we want it to be a place where the food has been broken down and nutrients are being absorbed. So it's more about nutritional absorption and breaking down versus that end stage fermentation that happens in the large intestine. Now, when we're talking about these different microbiomes that are in and around the gut, we need to understand exactly how different they are. So when we come to the small intestine, it's broken up into three bits. At the top, there's the duodenum, midway, there's the jejunum, and last kind of third is called the ileum. Now, at the very most in the ileum, we would be having per mil of fluid or per mil of whatever you would extract from that part, no more than 1,000 to 10,000 colony forming units of bacteria. In the colon, if you were to extract a mil of whatever it was in your large intestine, you would have 100 billion bacteria in there. You can see they are vastly different in terms of their microbiomes. In a SIBO state, it is anything above the 10,000 colony forming units that is considered an overgrowth. So a couple of thousand versus 100 billion, you can see they're very different environments. Now, when we have this issue of SIBO, you might be thinking, wow, like, why aren't we talking about it a bit more? That makes sense. The reason that it's not getting picked up is because it shares a lot of its symptoms with IBS. And there are probably a number of reasons that I won't get into, but it's not exactly a highly recognized issue, or at least it's not taken seriously. That is SIBO. That's not to say that it isn't research. There's a ton of research out there, but the people who are doing those first line investigations, they're looking at more that IBS picture. So often people are given an IBS diagnosis where SIBO hasn't been ruled in and ruled out. And you'll remember if you've listened to the IBS podcast that SIBO is an underlying cause of IBS. It can also happen without it, but it is also a cause as well. So just to give you an idea of the prevalence of SIBO and why it's so important and why we need to all be talking about it is because what we know is that around 11% of our global population has IBS. It is estimated that 60 to 80% of IBS cases are caused by SIBO. And so that it really is possible that there's up to 500 million SIBO cases worldwide, which is a staggering amount. And if that were true, why aren't we having these conversations about it a bit more? It's just such a missed issue in our gut. I feel like it is the endometriosis of the gut issues. We know that endometriosis is highly under-recognized, poorly diagnosed in terms of it takes years for a diagnosis, and yet it affects so many of us. Same goes for SIBO, that it affects so many of us, and yet it's just not being spoken about. So I want to talk to you about the symptoms of SIBO. This is something where I think you will start to self-qualify that, oh, maybe this is something that I need to look into. And if you've been told you have IBS, you should already be thinking, maybe I need to check out SIBO. But it presents quite similarly in terms of its symptoms. So you're going to have things like bloating and gas. You're going to be having food reactions, intolerances to things like FODMAPs and histamine. Bowel motions that are constipated, diarrhea, or alternating. You will have burping, but you can also have things like nausea, reflux. You can have leaky gut symptoms such as rashes and food allergies, and steatorrhea, which is like a fatty stool. So your stools will be floating, sticking to the sides. There's going to be like a fat malabsorption issue. Now, there are other symptoms that are related to SIBO that you might be thinking, oh gosh, do I have SIBO? You may not think, oh, well, I've got issues with constipation or diarrhea, but you may have some of these other issues that you might be thinking, right, well, this could be an underlying driver of that. And those are IBS, of course, but inflammatory bowel disease, celiac disease, fibromyalgia, restless leg syndrome, rosacea, reflux, as I mentioned, diabetes, hypothyroidism, diverticulitis, gallstones, interstitial cystitis. There are lots of issues that are connected with SIBO. And the reason for that is because SIBO is affecting a part of the gut. I mean, all of the gut is important, but it is affecting a part of the gut that is so important for nutritional absorption, immune function. It is where leaky gut is going to occur if it is happening. So it's affecting a really important part of the gut, a part of the gut. And when that is having problems, we know that there's the gut everything connection, that the issues won't stay just in the gut, that there's going to be some sort of systemic response or some sort of systemic issue. So looking at things like skin, inflammatory issues, immune issues, like there's going to be a few things that we can tie back to the gut. And maybe what is happening in the gut is a state of SIBO. So when we're talking about the clues that you have SIBO, in addition to those issues, you may be someone that feels worse with prebiotics or probiotics. You may have found that symptoms just never kind of went back to normal after a case of gastro. Your symptoms actually improve when you're on antibiotics, which you could be taking for a completely unrelated issue. You might have an infection, like an infected toe or whatever. You take antibiotics and all of a sudden your gut feels better. That's a bit of a clue that maybe there's this overgrowth occurring. You could be someone where your constipation worsens when you have fiber, that you react to sugar alcohols like xylitol or erythritol. And if you're a celiac that's on a gluten-free diet, and you still, have symptoms, then you may actually also have something else at the same time. So you may also have SIBO, not just celiac disease. Now, the only way to know this really is to test. Like, there is no way you can just guess and assume that you have SIBO just by these symptoms, even though, if it looks like a duck, sounds like a duck, walks like a duck, whatever that saying is, it probably is the duck. But there's a lot of nuance and there's a lot of, specificity around SIBO that we need to actually have testing on. So there are a couple of types of SIBO, and the way that we categorize them there's a couple of different ways. So there is SIBO based on your symptoms, which is similar to IBS, if you remember back in episode 11, but SIBO can be described as SIBO C for constipation, which takes up around 35% of SIBO cases. SIBO M, which is a mixed bowel motion, which is around 23%, and SIBO D, which is 40%. And there are people who have SIBO that don't have any bowel issues. They don't have any, I say, poo issues. They don't have constipation or diarrhea, but they may have rosacea and reflux, and that still could be their sign they have SIBO. You can also look at SIBO and categorize it on the type of gas that SIBO creates. And I'm going to get into this in terms of what I'm talking about. But I guess just to tell you the categories of it, SIBO, you can have a mixed SIBO status where you've got both hydrogen and methane. You can have hydrogen alone, so SIBO hydrogen dominance. You can have something called intestinal methane overgrowth, which it used to be called like SIBO methane or SIBO M, or SIBO, not SIBO M, SIBO methane dominance, but that's kind of been reclassified to intestinal methane overgrowth. And you can have SIBO, which is hydrogen sulfide dominant. So hydrogen, methane, and hydrogen sulfide are the three gases that can occur when you have SIBO. And so just going back to what we were talking about this fermentation process that happens in the small intestine, when these bacteria that are in the wrong place, that being the small intestine, come into contact with starches and fibers, they create a gas. And the type of gas that they create is dependent on the type of organisms that are within your small intestine. So if you have things like your E. coli, Klebsiella, Aeromonas in your small intestine, you're going to be creating a lot more hydrogen. If you have archaea, not bacteria, they're classified as archaea, such as Methanobrevesmithii, and there are definitely others, but that's a big one, you're going to be producing methane. And if you're someone that has Desulfur Vibrio piga, Biophila Wadsworth, and other hydrogen sulfide reducing bacteria, you're going to be creating hydrogen sulfide. Now, just to be super clear that if this process was to happen in this large intestine, it would really be considered normal. This is not a case of, oh no, my bacteria are fermenting, my organisms are fermenting. It's not a case of that at all. The real issue is that they're doing the right thing, but in the wrong place. And there's too many of them in the wrong place. And that's why it's a problem. So that is kind of where we're talking about the types, and really the gases that are being created are based on the type of organisms that you have in your small intestine. Now, how do we get these bacteria? There are three main underlying causes of SIBO, and usually it's not just one, it's usually a combination of things, although it can be just one of these things. But the three main categories to which why you would have SIBO would be that there is an issue and there is damage to your migrating motor complex and your enteric nervous system. So your migrating motor complex is this broom sweeping, like it's kind of like the house cleaner in your small intestine, and it cleans out bacteria. If that is damaged, then we're not able to clear bacteria from our small intestine. Things that can cause that are going to be things like mold, autoimmune, IBS, chronic infections, hypothyroidism, and food poisoning. The second thing is that there's an issue with your anatomy or structure, which is causing the outflow to be impaired, meaning that there's a bit of a blockage that is not allowing the bacteria to move through and into the large intestine. Things that can do that is different surgeries, endometriosis, and issues with your ileocecal valve. And third is that there could be some altered physiology or function in your gut that is not killing bacteria in the stomach or in the small intestine, where we would be wanting them to be killed. These can be things like an issue with your digestive processes, such as acid and enzymes and bile, because these can all kill bacteria, which is what we want that high up in our gut. Or there could be issues with chronic stress and low stomach acid, which is again that what I mentioned before about hydrochloric acid. Different medications can also affect these three different things, such as proton pump inhibitors, tricyclic antidepressants, and antispasmodics. So there's lots of different underlying issues that end up causing either one of three things in your gut, which then result in SIBO. So what we can start to see is that SIBO really isn't the root cause. It's a result of a lot of dysfunction in the gut. And I guess more specifically, like what happens when SIBO is in the gut and how it creates an issue that then becomes a systemic issue is that it damages our microvilli. So our villi are these finger-like projections that are in our small intestine. And these finger-like projections increase surface area that allow for better nutritional absorption. When there is damage to that, so whether they're inflamed or they start to get flattened, there is less surface area, which is a huge problem, not only for nutritional deficiencies, but for our immune system and for our enzymes that live there. We start to see issues like leaky gut and food allergies developing. We can start to see histamine intolerance, and we see damage to brush border enzymes. And this is where we have a lot of our key enzymes that are related to FODMAP digestion. That's where they all of a sudden become absent. They're not there to do the digesting. So not only do you have a damaged gut, but you've actually don't have the enzymes there to digest food, which is why foods like onion, wheat, apples, and grapes, and all of those healthy, high fiber foods are hard for you to digest. SIBO, when it's damaging that small intestine, can also cause issues with your bile. So we want bile to be created in our liver, spit out by our gallbladder, and that will help with the way that we digest and absorb fat and also absorb our fat-soluble vitamins such as A, E, D, and K, and also our essential fatty acids. If we have SIBO, we can often find that there is issues with how bile and fats are being utilized in our body, and we can start to see issues in these areas. We can also see that not only does our motility and our migrating motor complex cause SIBO, but the inflammation and the bacteria in SIBO further damage that motility. So it becomes a little bit of a circuit that we have to break. And that can obviously cause issues in terms of it's hard to treat SIBO if the underlying cause is actually being perpetuated, and if that can potentially result in slow bowel motions and output, which there's another podcast coming up that explains motility, which will also tell you that looking at your bowel motions isn't an accurate way to assess motility, but it is something that people can experience. There is also other nutritional deficiencies such as B12, magnesium, and iron that we find people are low in when they have SIBO. So we want to know how to test for SIBO. And when we start talking about all the symptoms and all the collateral damage that it does and all the other conditions that's associated with, it is still not enough to say for certainty, I have SIBO without testing. And I want to make this basically the take-home message of today is that we need to test. We cannot treat blindly under the assumption that it's there. And I will get into the treatments and to why that is so important. But I think what we're learning about our gut is that the guessing game just doesn't serve. We need to be testing so we can treat accurately and targeted. So there are two ways that we can identify and diagnose SIBO. The first is a procedure that would have to be done with a gastroenterologist, which is a small bowel aspiration. They are taking samples or aspirates from your small intestine and assessing those. This is not the way that I do it because getting procedures and getting gastroenterologists to do that is a long process. It does happen, which is why we mention it, and it is considered the gold standard, but it is not the common thing to do for various reasons. And it's mostly to do with accessibility and the fact that it's an invasive surgery or an invasive procedure, I should say. Stool tests are not accurate for SIBO. So if you've had a stool test, even if it's the most comprehensive stool test, it is not going to tell you that you have SIBO. So that is something which, again, like we actually need another test. We still need stool testing because it can tell us underlying drivers or the way that this large intestine may be supporting that SIBO status, but it's not telling us that there is SIBO. But the way that we do it, and this is the way that really a lot of the research is talking about, and a lot of the patients and practitioners that are treating SIBO, that's not patients treating it, practitioners treating it. This is how that they are assessing it, and it is through breath testing. Now, when it comes to breath testing, what we are capturing is the gas that your small intestine has produced because of that overgrowth of organisms that are there. That is being put into circulation and then exhaled through our lungs. And with the right testing equipment, we can capture that breath and then assess that for how much methane or hydrogen sulfide is present. And from that, we can chart that to see if there's an overgrowth. Now, I should say that hydrogen sulfide testing is not available in Australia for this breath process. If you are in America, I know there are companies that do that. In Australia, we have to work with just your methane and hydrogen, but there are other ways that we can interpret the test if we do think there's a hydrogen sulfide picture occurring. And this can also be used, and it really should be used in conjunction with symptoms, although we can't assume that the symptoms really kind of can tell us what kind of gas that is there. And I'll just explain that quickly, is that typically speaking, when we're talking about the symptoms, when we have methane, it's associated with slower bowel, so more that constipation. When there is diarrhea, it's more that hydrogen that you would assume is there. And when there is hydrogen sulfide, there can also be diarrhea, but there can also be a lot of sulfur issues like really foul smelling, sulfur smelling flatulence and things like that. Now, those symptoms, you can still not say for certainty that that is the type of gas that you're going to be dealing with. So testing is, again, why it's important. But when we are testing the breath, we are doing assessing bacterial fermentation over about 90 to 100 to max 120 minutes, but really is that 100-minute mark over 2 to 3 hours. So every 20 minutes, you'll be giving the test another breath sample for them to capture the breath and assess. And along that 100 minutes, which is going to be 2 to 3 hours within that intestinal tract, we're going to see either a rise or not of certain types of gases for which we can then say, yes, you have SIBO or not. So just to be clear, that methane and hydrogen are not produced by humans. They are produced by bacteria, which is why this test can work. And in Australia, if you do have a test where you've got your line, when you see the graph, if it's flatlining, so really like you're getting zeros and ones in a test, that is where we start to think it's a hydrogen sulfide picture, not a methane or hydrogen picture. So what we are doing when we're doing the test as well is that we're not just getting you to breathe randomly into a tube. What we're doing is that we are challenging these bugs. So we are deliberately feeding these bugs with substances that then get them to ferment, that get them to create gas in time for the test. Lactulose is what is primarily used for SIBO. However, not all bacteria ferment this. And sometimes we need to double up or even triple up with glucose and or fructose. And there are different pros and cons to doing that, in that glucose is really accurate, but only in the proximal part of the small intestine, so in the first hour. Otherwise, it's absorbed too quickly. Fructose we wouldn't want to do on its own. The trio of them is the most accurate way to get a SIBO diagnosis, but we can get it just with lactulose. And if cost and finance is an issue, which it usually is, we try to see what we can do with minimal testing and then increase our substances if we have to. The other thing that we need to know is that you can't just, test randomly, at whatever time of day. We need to have correct preparation when it comes to testing. Otherwise, you can get false negatives and false positives. Things that can influence testing can be different things like probiotics, proton pump inhibitors, even the presence of H. pylori can impact different gases. The same as if you haven't done the correct preparation diet. And there is a preparation period required to ensure that we are getting, again, an accurate test. Now, I had a great question submitted around SIBO and how do we determine between SIBO and IMO, IMO being that intestinal methane overgrowth. So there's a couple of things that I just want to, and I think it's really in the definition of that, which helps with how we, I guess, differentiate them. So SIBO-C, so SIBO with constipation, is a situation where there is bacterial overgrowth in the small intestine that could be hydrogen or methane, and there is constipation present. So you could have both gases or even just one gas, doesn't have to be methane, and there's constipation there. There is IMO when there's an excessive number of methanogens, which are the methane producing bacteria, in your small and or large intestine. And the way that that would be confirmed and I guess diagnosed on that test would be when there is a methane reading of 10 parts per million or greater at any point in the test, that can be considered for positive intestinal methane overgrowth in the presence of constipation. So it really comes down to the definition of these things that can help determine whether you've got IMO or SIBO. And even if you do or don't have constipation, it's about the levels of gases. So I hope that answers that question because it's a really good question. And it also brings into the conversation about how we can have these test results, but we need accurate analysis and interpretation of that, and then ultimately implementation as to how we treat these results. So there's a couple of mistakes that people are doing when it comes to testing for SIBO. First of all, it needs to be made very clear that lactulose is different to lactose. I have people come to me that have said, well, I've done a lactose test with my doctor and it's come back positive or it's come back negative. Great, that's not SIBO. So lactose is not lactulose. They are two different substances. The other thing is that there are differences in terms of the quality of companies that we use. And I'm very specific about the company that I use and refer my patients to because I'm very clear about what I want in a test. And that is that they use carbon dioxide as, I guess, an insurance to see that your breath sample was, in the right levels that it needs to be. That the breath samples that they're asking the patient to do is every 20 minutes, not 30 minutes. So every 20 minutes, we want a new breath sample taken to assess and not 30 minutes. Otherwise, we can miss rises in fermentation. And the other thing is that it's testing for both hydrogen and methane. And if you're lucky enough in America, you can maybe get the hydrogen sulfide as well. But just testing for one of those also doesn't rule out SIBO. So we need to have those three, or the two gases, three if you're lucky, if you're overseas. We need to make sure that it's a test that assesses every 20 minutes and that there is a carbon dioxide or a CO2 insurance, I guess, test where they're doing it alongside when they're testing for your hydrogen or methane. So once we've determined that you have SIBO, we need to be looking at how to treat this. And there are so many ways to treat it. And this actually does deserve its own episode because it is just so full on. And I remember back in the day when I first was learning about SIBO, there was this discussion and this thought that treating SIBO took you 6 to 8 weeks. And I have almost never seen that, even way back in 2016. I've never seen SIBO be treated simply. And I think it could be a number of things that our environment, our underlying causes are getting more complex. Maybe there's resistance to some of our treatments. Like, I don't know the answer to that. All I know is that that's an unrealistic time frame to treat SIBO in. And I've treated people since 2016. There are different things around this. Now, I want to be very clear that diet is not a treatment of SIBO. There is no amount of healthy eating or low FODMAP or even SIBO diet that can actually get rid of this overgrowth in the small intestine, which is the first part of the treatment. Instead, diet really is used for symptom relief, reducing inflammation, but it really cannot eradicate. So don't feel that just because you're feeling better have on a SIBO diet that your SIBO is gone. It's just likely that you're starving your microbiome and that you're like, oh, that's a good thing, but it's actually not, because it's also starving your large intestine, which we know can have trouble down the line if it goes on for long periods of time without fiber. So diet is used for symptom relief and reduction of inflammation for a short period of time. What we actually do want to be using is prescriptive medications or herbs to treat the organisms there. And the types of medications or herbs that we use, and I can't prescribe medication, so I refer out because that's not my wheelhouse. I'm not a doctor that can do that. So I use my herbs. We need to determine what type of herbs we use based on the type of SIBO that you've presented with the gas that you've seen on a test. This is why testing is so important, because we do not want to be giving you a herb or an antibiotic that is redundant. That's a waste of time, energy, money, and it is damaging to your microbiome. We want to be very, very selective with what we're using. And herbs that we might be considering for hydrogen would be in the berberine family. Methane can contain allicin and oregano, and hydrogen sulfide can contain oregano. Now, it's absolutely not prescriptive what I'm telling you right now. And in fact, it is so much more complex than just taking these antimicrobials. As I've said, treating SIBO is actually a really complex thing. But there are many options that we have. And there are studies showing that herbs are as effective as prescriptive medicine. And I've seen that to be true in practice. And I've also seen that some people aren't responsive to herbs that are responsive to prescription, and vice versa. They aren't responsive to prescriptive medicine, but they are responsive to herbs. So we cannot make a blanket statement and assume that you'll perform or you'll respond better to one. We need to sometimes do a little bit of dancing and a little bit of adjusting, as in time, and retesting throughout just to see how effective our treatments are. Now, there is one treatment that isn't actually a killer in a sense where we're using an antimicrobial or a herbal prescription medication or a herbal antimicrobial, and that is the elemental diet. This is something that it is a really, to be frank, hardcore kind of like fasting. You're not fasting in a sense where you're not getting your nutrients, but you are consuming a very specialized liquid drink for 2 to 3 weeks. This is something that I educate my patients about extensively before we start to do this. And to be honest, I've only had probably less than 5 people in my, probably actually, no, that's a lie, maybe less than 10 people in my years of doing SIBO that have felt mentally up to doing this elemental diet. Now, this is something in my SIBO treatment episode that I'm going to talk about in more detail. But just so you know, there are options where if the herbs aren't working, if the prescriptions aren't working, that there is an actual elemental diet that we use. And it is very unique. It is unlike anything that you've probably thought of before. And no, it's not a protein shake or water fasting. It is prescriptive in its nature. So we've spoken about how we kill the bacteria, but that's only part of it. And in fact, a lot of people that I see have this idea that killing the bacteria is the goal. I mean, it's the first goal, it's not the goal. The other goal is to really understand what was causing the SIBO so we can address that. And this is where the underlying causes are just so important to sustaining those results. If you kill and do nothing about those, you will relapse. In fact, there's studies showing that about 45% of patients will have recurrent SIBO following antibiotic therapy. So this is like almost 50% of people after the antibiotics will relapse. Now, this will be a higher rate if you're an older patient, if you've been using proton pump inhibitors, and if you had your appendix removed. This is what this study was saying. But I would say that this is because the underlying root cause and drivers haven't been addressed properly, because, the thing that was causing SIBO is still very much there. Now, we spoke about what that was in terms of there's the impaired outflow, there's the motility in the gut, there's those three things that we were speaking about, which are still present. So we need to look at really what's causing those. So What we can do to reduce the risk of relapse is supporting those. And this could be doing things to stimulate the migrating motor complex, supporting our digestive factors, removing any medications that are causing SIBO. And I say that to do under the care of the prescribing practitioner, not to do it on your own. Of course, we need to do this safely with, again, that prescribing practitioner. We potentially need to look at other things like visceral manipulation or supporting the ileocecal valve. We might be needing to correct some chronic stress and sympathetic dominance, treat and support any conditions that contribute to SIBO, and also support that microbiome dysbiosis. So there's lots of things that we can do and that we have to look at to see what is it about your current state of health that has supported SIBO to be here. And that's where we need to work. So when it comes to this treatment of SIBO, I really want you to be realistic about the expectations around recovery and how long it takes. And I've told you that, gone are the days where it's 6 to 8 weeks. It is, for many cases, it is a months-long process. And I've got people that unfortunately we're looking into years. It is not linear. I've had people that we have amazing results, we retest and it's higher, and then it goes low again. It is a lot to deal with for both patient and practitioner. So I say that to be like, if you're getting results that you're like, this is a bonkers result, I didn't expect this, to know that you're in good company, and this is often what we see. It is also very often where I have patients feeling better, but their results are indicating that there's still gases there. And that is also, I would say, still a clinical win in that we've got much better, resilience in their gut, less symptoms, so less gas, less bloating, less constipations, all those things. And that even though there are still gases there, that overall that patient is feeling better. That's also super common. And we again approach that with the mindset of, what is it that is making this bacteria hang around? What else do we need to do? So be prepared to look at SIBO as a bit of a commitment. It is a longer journey than just a quick, antibiotic for an infected toe or something like that. It often requires a few rounds, and you may need to change up your treatments just so we're keeping these bugs guessing. And it is holistic in its approach. We need to be looking at the underlying drivers. So that is looking at stress management. It's looking at supporting if there's endometriosis there, if there's celiac disease there, if there's low stomach acid there. All of these things are absolutely part of that holistic support. Now, I also want it to be very clear that restrictive diets are not the SIBO treatment. They aren't the forever treatment, and they're certainly never, ever, ever the goal. If you are put on a diet which might be lower in fiber, could be a low FODMAP or a SIBO biphasic diet or something like that initially, that is serving its role in terms of reducing symptoms and reducing inflammation. Of course, if there are eating disorders in place, we have to modify our approach. But modified diets can be a very helpful part of that process in the initial phases. They are not the end goal. What we are hoping is that with the removal of the bacteria and the healing of the gut and the supporting underlying issues like acids and enzymes, that all of those things are working better so that you are tolerating foods that are high fiber, highly varied without an issue. Now, this is a slow process. This is something where you may have had SIBO for a number of months or years or even decades, and that it's going to take time for the gut to feel safe and capable to digest the foods that you're now giving it. What we want to do is be very gentle with that process and to be increasing the foods that you're having in a very incremental way. We don't want to go from that initial restriction to total abundance. There needs to be stages, and that looks very different for everybody. So it needs to be in conjunction with support, but also a very intuitive process as to how you introduce foods into your diet. Now, if you are someone that, is looking for a practitioner to work with to really understand your SIBO, what I would say to you is that you need to be looking for someone that is experienced in SIBO. And I'm not talking about someone that says, oh yeah, I've had one or two, patients with that. I'm talking about someone who lives and breathes it. Like, this is an evolving issue that has, from when I first heard it, has changed. With, IMO wasn't even actually the true classification of it. So there are even ways that we're reclassifying it. There's new treatments coming up. There are new ways that we are supporting it. And The only way you know that is that if you're living and breathing it. So it is a very complex issue. And I say that not to scare you, but just to say that you do want to be working with someone who feels confident in the complexity, because you want to be, having that confidence in the process, where there might be times where you're not feeling so confident because you've got back some results that don't quite reflect the hard effort and energy that you've put into it. And they're hard conversations to have, but again, super common. It is absolutely possible to be symptom free though, and SIBO free though. I've seen that countless times. It's just there is no, it's how long's a piece of string. That's how long I say to people, how long does it take to get rid of SIBO? How long's a piece of string? It depends on your starting place, what underlying drivers that we're working with, different things like your tolerance and compliance with treatment. Like there's just so many moving factors. So again, it is super individual. But if I wanted to give you, and this is my last piece of advice around SIBO, again, before I do another podcast, another time, another episode going through testing maybe and treatments in much more detail, because we could be here for 5 hours if we were to do it all at once. But if I was to give you something that, you were to be doing if you have SIBO or suspect you have SIBO, I've actually got 3 things that I want to share with you. So write them down. These are really important. And I feel like these are the difference between people getting better and not. The first one is nervous system support. Not only is it a driving factor of SIBO, we've spoken about motility and enteric nervous system dysfunction, but the process of SIBO can be stressful for people. So stress, anxiety, overwhelm, these are going to be things that are perpetuating the SIBO issue. And we really need to manage it. And I mean that in the most heartfelt way, that it's sometimes the harder thing to do. Taking antimicrobials is easy compared to stress management and supporting your nervous system, but it is so important. And there are a billion ways to do that. And it might be something that evolves over time. It might start with meditation first. It might start with essential oils. It might start with, breathing, counseling, kinesiology, somatic healing. There are just so many ways that we need to support our nervous system, and it needs to be up there as basically priority as much as anything else that you do. The second thing is to test, not just once. We want to test throughout the journey. I normally say, and this depends on the person, but ballparking that every 3 to 4 to max 6 months, I want to test my patients. If budget allows, that's ideal. If not, obviously we have to push it out. But that is just to make sure that we know what we're working with. We're not using outdated data. We're not treating longer than is needed, or if we're not treating in an incorrect way. So we want to have updated data that we're working with. And just for a ballpark, a SIBO test in Australia, a lactulose only, is around $200. So if we can work to budget that in every, 3 to 4 to max 6 months, that is something that I feel is so helpful for your journey, because again, we know what we're dealing with. And if after 6 months we still haven't made a budge in your SIBO, then we totally changed our approach. We don't keep doing the same thing. We want to know that what we're doing is working. And if not, we also want to know that too. The last thing is having a food inclusion mindset. So food is not the enemy. It's also not the cause of SIBO. But what it is telling us when we're reacting to food is that things aren't quite right. Things are unhappy in the gut. We want to be working with someone who can support how we include more food in our diet. And that could mean digestive aids, where we're looking at ginger or digestive enzymes that are appropriate to your issues. We could be looking at peppermint. We could be looking at certain probiotics. Also not taking things without changing how we eat. So we need to be eating in a slow, in a very mindful way. All of those things can help. And keeping that goal in mind, where eventually, we want that diet to be full. So supporting that inclusion process along the way and getting small amounts of food in an incremental way is really what we want to be working towards. I definitely don't want to see patients 6 months from when we first started on the same SIBO diet. In fact, I would be very concerned if that were the case. And so as soon as it's appropriate, we really start to open up that diet. So this is really, as you can see, kind of an overwhelming snapshot of the SIBO process. It really is this huge issue that we aren't still talking about enough. I know that there are pockets of the community, pockets in health that are talking about it. I'm grateful for that, but it needs to be as known as IBS because they are so closely linked and it affects so many people. If there is anything that I can give you from today, it is to share this with someone who is potentially experiencing issues that you, after hearing this, think, I think it might be SIBO. And if not, we need to figure it out one way or another. We need to, you know, take this to get rid of that differential and then focus on what else it is if it's not SIBO. But very often it is SIBO. If you think it's SIBO, it's most likely SIBO. If you want to go further with your journey and you are so ready to work with me in this process, I'm going to put my links in the show notes with how to do that. And to do that, just to verbalize it, is working on my Bloated to Body Confident program. It is the step-by-step process that is helping people with bloating and IBS and SIBO achieve that food and symptom freedom. So I'll leave the show notes in there for you. I hope today's been an empowering and enlightening episode for you. I cannot wait to come back on here and talk about SIBO in more detail with the different aspects. And if you have questions about SIBO, please send me an email. Connect with me on social media. I'm on Instagram at rachel.larsson with your SIBO questions, and I will make sure that I answer them in my upcoming episodes. Thanks so much. Thanks for tuning into Gutsy Talks. I hope today's episode left you feeling inspired to take the next step in your gut health journey. If you're ready to dive deeper, head over to rachellarson.com.au. There's a range of courses and resources waiting for you. If you loved this episode, I'd be so grateful if you shared it with others who might benefit from this information. And so you don't miss out on future Gutsy Talks, be sure to hit follow and leave a review. I'd love to hear your feedback. I'm Rachel Larsson, and I can't wait to connect with you again for our next Gutsy Talk.